Okay, today we're going to be doing an E-stem treatment of combo and rushing. First thing I would do is get the equipment ready with towels and cooling gel for the ultrasound because we're doing combo. I would look at the patient, make sure there are no presence of contraindications in the treated area. I would ask them if they've ever had any kind of E-stem treatments before at all. And I would also look at the machine to see if there are any cracks in the screen, fried wires, anything like that. Make sure the electrical outlet is plugged in well and no fraying is going on and the cord is going down. So looking for contraindications, I would look at the treated area to see if it has any kind of bruising, hematosis, scars, open wounds. Look for the presence of broken bones and maybe torn fibers, anything like that. Okay. So moving on from there, I would make sure the patient is in a comfortable position on the table, just for the affected area. So sitting up would be comfortable for him to get his VMO, which is the area we're treating today. So looking at the treated area, I would check light touch perception, ask them if they can feel that. Capillary refill, make sure the skin returns back to its normal color. And for pulse, I would check the dorsal pedal artery down here. Not the dorsal, the posterior tibial artery, excuse me, down there, to make sure that's okay. And then I'll come over here to turn the machine on.
Yeah, I mean, ideally,
first thing we're going to do is combo.
Yeah, if you feel that balance, you just shrink it up. Yeah, diabetics often lose extremities, especially legs.
Just like that. So it won't really stay. Put that right there. Apply the gel first. We'll get that in a minute.
Okay.
She's at a different place.
Just make sure you speak.
Find her and then she moves. Followed a new account today.
Do you have a
questions?
First I would just apply the ultrasound gel before I turn it on, just to get it in the treatment area. Keep it relatively small, probably about right in there, the treatment area. The first thing we would do is go to at the parameters. We'll keep it at a duty cycle of 100%, and we can put the frequency to 3.3 to get a deeper heating for this one. We'll put the treatment time at 10 minutes.
Right at 1 o'clock and they're at Rutgers.
For the waveform,
They're at Rutgers. And the
we can just keep it at...
Our cameraman just got hit by a water balloon. They're in live TV.
I'll move it down to pre-module, just keep it there. At the stem, make sure the sweep
I wish it would have been the extra
turn on or off. We'll have the cycle time continuous, and we'll fix it at, let's just say, 120. Okay, so now that we've had that on there, we'll place the pad on first.
See, there's a few people with some Manchester University crushes on me.
The second one was
Pads. Just need one for combination. When I'm applying the pads, I want to make sure that the area is free of oils on the skin, things like that, that might, hair maybe that would block the treatment. So just place that right there. So a little bit farther. So in combination, the first thing you want to do is increase the intensity of the ultrasound treatment.
I don't understand why you can make something in the microwave in like 2 minutes, where if you were to cook it in the oven, it takes 20.
Because you get a full round cook.
It makes you feel good about yourself.
Eat
You
not
feel something,
microwave waves.
I know. I think microwaves are like.
1.7.
They're not. There's a
They
study
did a
done
study.
And then we'll edit the stem. And we'll turn that intensity up
that the nutritional value of your food in a microwave goes down like 30%.
to 1.8 as well.
I heard that they did a
Let's
study
start on that.
Oh yeah.
So you can see down here, we've got the stem pad going, as well as the ultrasound. The ultrasound acts as the other stem pad in this situation. So I want to keep the circles in really tight form, small, and just around a small area, because if I go, and I want to remain pretty far away from the ultrasound head just to not cause a polarity shift. You don't want negative and positive poles meeting at the same time. That wouldn't be very comfortable. So say if we're about halfway through treatment and a patient can no longer feel the treatment effects, I can always turn up the intensity. And I'm turning up the intensity of the stem now, and I can just go to ultrasound and turn up the intensity of that as well. Okay. So now that treatment's over, we would say stop. We look at the treatment parameters, if that worked for them well. I would ask them questions. How did that feel? See what their reactions were. I would also look at the skin for any adverse reactions of that treatment. And you want to record the treatment parameters, because if that worked for them, you could do that next time and build upon that and reevaluate. I'm taking this pad off and just putting that back in its proper location, along with the ultrasound head. I want to take the towel, wipe the ultrasound head off, make sure that's off, and then wipe off this area.
It's World War III.
That is what it is. No, but
It's kind of the same procedure for the Russian as well, which is what we're going to move on to next. This time we have 2 pads.
How you feeling?
And Russian is usually used for re-education purposes. It delivers a strong burst of muscular contraction, which would be good post-surgery for an athlete who's trying to look to get function back in the muscle.
No, we're not going to do it.
So again, we'll do the VMO. Put 2 pads down here. Put the black cord at the distal extremity. And the red cord would go closer to the heart at the proximal extremity.
Yep.
Alright, so going back in here, we just go home. We use electrotherapy. We go to Russian. Edit parameters. We keep the duty cycle at 50% because that's usually what Rush is having. We'll get a 2-sec ramp. That would be kind of a gradual ramp up to the contraction. We'll adjust the burst frequency to 70 BPS. And cycle time, we'll keep, not continuous.
It's the silver spoon method.
We'll keep it at 10 seconds on and 30 seconds off for this particular example. Adjust the intensity up to 2. We'll make the treatment time 10 minutes again. So for 10 minutes, every 10 seconds, this is going to ramp up to contraction and then rest for 30 seconds. So then we'll start this.
They have one now that you can sign up for. It's a smart home. You
You feel that?
Yeah, I'm signing up for this one. Everything is can be used through a smartphone or a smart tablet. So
Say if
you
the
can
patient isn't feeling the treatment, we can also
turn
adjust the intensity as well.
your shower on from bed. Oh my! Control the temperature. You can feel your bathtub up. How about bed?
The downfall of America.
You gotta wait 30 seconds until it ramps back up.
Right there. Like water bottles? Oh, yeah.
So now it's going back up, and we can adjust it as it's going back up. We'll adjust it to 4 milliamps,
Oh, that's a great.
and then it will go back down. So it'll just, like I said, it'll continue that pattern for 10 minutes. Every 10 seconds we'll get a burst of intensity, and then 30 seconds of rest for muscle re-education. So, stopping this treatment, once again, just like with combo, you look at the treatment parameters, make sure that everything, the information in there is all written down, and you're able to go back and refer to that again.
It was nice out yesterday. Why did you skip yesterday?
Take the pads off, and look for any adverse reactions on the skin. Ask them how the treat area feels, and I'd also during the treatment want to make sure that they're comfortable and that it's not hurting them, or if they need the intensity ramped up. Lastly, I would put the equipment back in its proper place, putting the pads back on. Adhesive. And then wrapping up the cords. And then again, just asking the patient if they have any questions as far as the treatment goes, what they need to do or what they need to do next time. And that would be a combo and Russian ultrasound treatment.